Joining me now from New York City, family physician and healthcare policy expert, Dr. Jonathan Vitale. Doctor, I firmly believe that what we're looking at here in the Republican plan, and they tell us there's 2 more phases, I don't buy it. I think this is Obamacare 2.0. My question I ask kind of rhetorically, but also plaintively, why can't we return to what we had, say, 50 years ago, when we had a good doctor-patient relationship? Why is that so complicated?
Yeah, well, first of all, thanks for having me, Graham. And I agree with you. Look, this Obamacare 2.0 or Ryan Care is not a repeal and replacement of Obamacare. It's essentially a repackaging of Obamacare that they're rolling out as changes that can be made to budget reconciliation before we can get to the real changes that the constitutional conservatives want to see, the changes in the legislative process, which would be the opening up the state lines, the competition, and also dealing with prescription drug costs. The issue, and other things, but the issue that you bring about is a fundamental one. I think the issue here, though, is once you give people an entitlement, once you give people free health care, it's really, really hard to take that back. You mentioned health care 50 years ago, and you're absolutely right. It was a lot better back then for both the patients and the doctors. They had essentially full control over the decisions they made, over the health care that they received, and it was all cheaper as well, and everybody was happier. And I think that it really has to do with this notion that Barack Obama put forth that every American should get free health care. And we've seen time and time again in American history that once you give somebody an entitlement, right, which still remains under Rhino Care, by the way, with the refundable tax credits, you really can't take it back.
Somewhere Barack Obama is got his feet up on a desk, smoking a cigar, watching this, because he realized that if you keep any parts of Obamacare in place, like a weed, it is necessarily going to grow back at some point, especially when there's a Democrat in the White House once again, and when the Democrats have control. I want to talk about this budgeting process in a second, but first, if you just look at the prima facie scoring of the CBO, it's going to scare off some Republicans for voting for this thing, because you hear Nancy Pelosi and Chuck Schumer out there saying, 24 million whatever people are going to potentially lose their insurance, so they're going to lose. They're going to lose their insurance. But the real reason, doctor, they're going to lose their insurance is because if the mandate goes away, many people are going to walk away from these huge monthly payments and these tremendously high deductibles.
Yeah, I mean, it does not take into account, the CBO does not take into account the number of Americans who will voluntarily drop their health coverage once they no longer need to get it. And I think that's a really important thing to understand. The other is that 10 years down the road, who knows what's going to happen in healthcare? Hopefully, if what the constitutional conservatives want to happen, if that goes into place, which would be a lot more freedom, a lot more choice, a lot cheaper plans, a lot more price transparency, then people would have a lot better options than just buying a healthcare plan. So I think the CBO numbers, first of all, we know by their history that they are not that good at predicting the numbers of people who will be covered by insurance plans, as we saw with Obamacare, where they overestimated by over 2 times the number of people that would be on Obamacare. But also the numbers that they give just gives ammunition for the left in order to say, hey, you're going to lose your health insurance, when they're not saying, oh, well, if we kept Obamacare, many of you would still lose your health insurance. So it's comparing bad apples to bad apples, instead of starting over.
But how could you ever correctly score a behemoth like this? You're talking about the public sector trying to score the private sector. The public sector doesn't know what the private sector does, doesn't know how it operates. I mean, I wonder if they scored Medicare and Medicaid and Social Security. They probably didn't score it back then, but I'm sure they would have been wrong on that. But I want to review real quick what this phony repeal is all about, and I underline phony. Pre-existing mandates will stay in place. The essential benefits, that is me paying for pap smears and mammograms, stay in place. No lifetime annual cap. By the way, that in and of itself is a death spiral for insurance companies. And I'm no special pleader for insurance companies, but you can't operate a business that way. Limits to out-of-pocket costs and young adults staying on their parents' plan. I've never understood that one. I have never understood why leaving a 24-year-old I have a 21-year-old daughter. Why it's so great to leave her on my health insurance plan when she's 24. I think it's not so good. But the bottom line is this budget reconciliation that you mentioned. I think what's happening in the Senate right now is that Mitch McConnell realizes that he has all of these rhino Republicans. They could fully repeal Obamacare if they have the votes. I don't think they have the votes, and therefore they're going to leave these elements in there. They're going to say, oh, we'll deal with it on another day. They're using a parliamentarian excuse, which is all nonsense. I believe the Republicans, after all of this, Doctor, after all of these years, after all these phony repeals that they passed, I believe they don't have the votes to pass it.
Yeah, you know what? They probably don't. What's going to happen for any progress to be made is Donald Trump himself, who's known for being one of the best negotiators out there, is going to have to reach in and start negotiating with the other side. Because if he doesn't, we do not have the votes to even, I don't even think we have the votes to pass the House, much less the Senate. So I think Donald Trump's entire presidency is going to ride on this, because keep in mind, Graham, if the GOP messes this up, we're looking down at a Democratic president in 2020 and a universal payer.
That's a good point.
So this is the last shot that we... Yeah, this is the last shot that we have, because keep in mind that Obamacare was built to implode onto itself into universal health care. So this is the last shot we have. This is all we got right now, and Paul Ryan is trying to present this as best he can. And there's a lot that we can only get done with budget reconciliation. But the real bulk of the change that we want to see, that the Freedom Caucus wants to see, that real constitutional conservatives want to see, that's going to take 60 votes in the Senate under the third step of this, which is the legislative changes, and that's what we actually are going to need the debate about and the negotiation for. So that's what we have to wait and see what happens.
Again, the ball's in Mitch McConnell's court on that one. He could get rid of the filibuster and cloture if he wanted to, but for some reason he's not doing it. And then once again, I make the point that through budget reconciliation, they could eliminate virtually all of Obamacare. They're just afraid to do it, or they don't have the votes. The bottom line is, I think you and I would agree that there is a free market solution out there, and that is the solution that should be pursued, period. Doctor, thank you.